Hi, this is Nilanjana. I've been a doctor for the last 25 years and a GP for the last 20. This video is titled Breast Lumps in Women, and I'm doing this on the personal request of a close friend of mine. You know who you are, and it's an absolute pleasure doing this for you. We do see breast lumps in men and children, but for the purposes of this video, we are going to discuss breast lumps in women. When I see a person, a patient coming in with a breast lump, I ask them a few questions, and these are just routine questions, but they all help us make the diagnosis or actually help us think on a certain line or a certain tract. So the first question is, how long have you had the lump? Have you had the lump for a very long time? It has suddenly changed and gone painful? Or have you only noticed the lump last week? Was it never there before? If it is painful, how painful is it? Are you having to take painkillers? Can you not lie down? Or is it not painful at all? Or it hurts only when it is touched? The breast lump, is it related to periods? Is it becoming tighter and sorer before a period? Or is it not affected by periods at all and stays just the same whether you're due on, whether you're in the period, or whether you're after the period? The other thing we want to ask is, if and when you had children, did you breastfeed? If so, how many children and for how long? Breastfeeding is known to reduce the chances of breast cancer. So this is an important question in the checklist. The next question is about cancer screening. So if it's a senior patient above 60, we will ask about bowel cancer screening. If it's a younger patient, we will ask about cervical cancer screening. And there will also be questions about, any kind of cancer in the family. So that can be bowel cancer, lung cancer, prostate cancer, any other cancers in the family. And then we can then move to specific cancer questions. So things like, how many people in your family have had breast cancer? How were you related to them? Were they first degree relatives? Were they your mother or your sister? Was it an aunt or a cousin? And having a first degree relative with the proven breast cancer puts a person at a higher risk of having breast cancer. Some breast cancers are genetic, so if this happens, then we can refer the patient for genetic studies, and then we can try and look after future generations with this knowledge. The next question obviously is a cancer question again. We'll ask about the loss of weight, the loss of appetite, and the loss of sleep in the patient. Once we've gathered all the information, I will then do an examination of the patient, examining both breasts, examining both underarms, and examining the abdomen. After the examination, I will discuss the findings of the examination with the patient, and then we will go on to the next step of the management, which will be referral to breast clinic. In my practice, I tend to refer most patients to breast clinic, which is basically a breast cancer exclusion clinic. Patients get seen and they go through all the tests in rapid succession, and by the end of the day, most of the patients have an answer whether the breast lump is something to be worried about or not. The tests include an ultrasound scan, a mammogram, and a fine needle aspiration. So once they've had all the tests, the fine needle aspiration has been seen, and then the specialist will speak to the patient and discuss what they found and what the further steps of management are. My friend specifically asked about breast self-examination, so I will be speaking about that now. Breast self-examination is much talked about in the press, and it is one of those DIY things, I think, because DIY is very much in fashion. But I would think that breast self-examination is very, very difficult, and it is very, very subjective as to what you're going to find. If you have done breast self-examination, which to begin with is a very, very difficult test to do on yourself, if you've done that already and you think you have a breast lump, please, please, please get in touch with your doctor immediately. Please do not Google, as this is an important finding and you need to discuss it with your doctor. Say for example you feel you have a breast lump and you go to the doctor and the doctor says it's not a breast lump and there's nothing to worry about. That is absolutely fine. You've not wasted anybody's time, and this is something you should do for your own health. If I see a patient who comes in with a breast lump and I examine them and then I find that there is no lump and there is nothing in the breast, everything is fine, it is actually a very happy consultation for both myself and the patient, and we both walk away from the consultation smiling happily. I don't think anybody minds seeing you if you feel or you're worried that you have a breast lump. So although breast self-examination is notoriously difficult to do, if you have done the examination on your breasts and you feel that you have a breast lump, please don't sit on it, please don't Google, and please get in touch with your own doctor straight away. I have tried to go through the long and complex topic of breast lumps in women in general detail, but if you have any questions, any queries, or any suggestions for further videos, please put them in the box down below. I do hope you have enjoyed watching this as much as I have enjoyed doing this, and I wish to see you soon. Take care and all the best.